In today's video, we're going over my favorite beginner exercises for rotator cuff related pain. So Peters et al. In 2020 gave a strong recommendation for exercise in the treatment of subacromial pain or rotator cuff related pain. And when someone comes through the door, even if they want to get back to something like bench press or overhead press, you got to start with the basics. So in today's video, I'm going to go over my favorite beginner exercises to get people from here up to here, and in the future, up to here. Generally speaking, the rotator cuff tendons that are most often involved or injured are going to be either the supraspinatus on the top of the shoulder or the infraspinatus in the back of the shoulder. So you can have an injury to another tendon, maybe subscapularis or teres minor, just not as common. The other piece is that in folks in the gym, when they have shoulder pain, the movements usually hurt the most are heavy bench press and also overhead press and maybe some incline press. But generally speaking, it's pressing that hurts, right? No coincidence that when you injure your infraspinatus and your supraspinatus, those are the rotator cuff muscles that are most involved during pressing. So it makes sense. Most folks have rotator cuff related pain in the gym, hurt during bench press and overhead press, particularly because these movements just use that part of the rotator cuff so much. So generally speaking, with tendon pain, the way we get better is by loading the area that's painful, right? So doing exercise that directly target the supraspinatus as well as the infraspinatus. And I'll go over my favorite ones. Far and away, one of my favorite beginner exercises, particularly for the infraspinatus, is going to be sideline dumbbell external rotation. This is probably the most boring exercise of all time, but it's probably the most evidence-based exercise for shoulder pain that we have, right? The other piece is that most folks that want to get back to heavy bench press need a strong functional infraspinatus, okay? And this is a very good place to start. So in order to do this exercise, you have your patient lie on their side, just like so. And then from here, elbows right on the side. I have a towel underneath of our athlete's elbow here, and I want you to push down into that towel. And as you push down, lift your hand up into my hand right here, and then right back down again. So the reason why they add the towel is that when I push into the towel, reduces work of the deltoid and increases work of the infraspinatus. So we're able to better isolate or better target that tissue that's a little bit painful. Next exercise for rotator cuff is good old scaption. Now this is probably the best way to apply some good old exercise medication right to that supraspinatus tendon. Folks have that good old pain down the side of the shoulder, right through the front. Maybe that's your supraspinatus. So the exercise is performed with thumbs up, okay? Sometimes they're called full cans. Empty can would be dumping out your can, and then full can, obviously thumbs up. The other thing that's important about this exercise is we're in the scapular plane. So essentially, we don't want to have hands right out in front of you here lifting up, and we don't want to be directly out to the side. We're about 30 degrees right here, down and up. Let's do a few repetitions, right? Super basic, super easy, usually feels pretty good. And like the infraspinatus sideline external rotation, a lot of evidence to show this is beneficial.
To go along with this video, I have a free cheat sheet for you. It is an evidence-based cheat sheet for rotator cuff related pain. I'll give you all the knowledge to go from a beginner to a master understanding rotator cuff related pathology. We go over the prevalence of these conditions, as well as the anatomy. We talk about the difference between tendonitis and tendinosis. We chat about risk factors that increase your likelihood of getting rotator cuff tendinopathy and tears. We talk about the clinical presentation of this disorder and also which tendons are most commonly involved. We talk about the different stages of pathology and whether or not the rotator cuff tear heals over the course of time. Next, I give you the bullet points about rehabilitation expectations, and we round out the PDF with some surgical guidelines which your patients should go on to get surgery for rotator cuff tears. So I'm going to leave a link in the description, in the show notes. Again, this is 100% free. Go ahead and download this right now.
Next exercise I like for the supraspinatus is going to be sideline scaption. So a little bit of physics to start. So when I'm doing a regular scaption standing, when I initiate the movement, there's a very small moment arm from my hand to my shoulder. So essentially it's not very hard during this part of the motion. As I get higher, up to shoulder level, I have a longer moment arm, and essentially this is the hardest part of the movement generally, right? So when I'm doing a heavy overhead press, usually the hardest part of the motion is towards the bottom, right through here. And largely, if you look at my elbow angle, it's right here. So I like to train the sideline scaption because it's essentially the opposite of a regular scaption, meaning that, let's have you do one repetition and come all the way up to the top. At the very top of the motion, hand is stacked over the shoulder. There's no moment arm for the shoulder to produce force. But as he goes further and further down, it gets harder and harder and harder the moment arm grows, and it's essentially at the hardest part of the movement right here. So we're training the shoulder position we need for an overhead press a little bit more by doing a combination of the regular scaption as well as doing a sideline scaption. The other thing to think about is that when you're doing sideline scaption, the first few degrees of scaption is when the rotator cuff is most active, or the supraspinatus specifically. So we're basically training the supraspinatus in the position where it's actually most active, whereas when we're doing a standing scaption, the delts are going to take over a little more as we get a little bit higher here. The next rotator cuff exercise I really like is a cable fly. Now you might be saying, Dan, cable fly, that's not a rotator cuff exercise, and largely it's not. It's usually considered a pec exercise, but a few things. So for one, when folks are really painful in the gym, oftentimes they're dealing with rotator cuff issues, but sometimes the pecs can get involved, right? Pecs might be a source of pain. Think about where the pecs, that's right in front of the shoulder. This is where people typically have pain. So oftentimes I will give them some flies because they might be dealing with additional things besides just a rotator cuff. The other piece is that we're essentially doing resisted flexion and a little bit of horizontal adduction. So the rotator cuff is definitely going to be involved for this exercise. And the other reason why I really like it is because when we bench press like this, pretty much the same exact thing as doing a fly just right here, right? So let me show you Mike doing a fly right here, grabbing onto the handles, and then let's have you just get in your starting position and just appreciate where his arms are, and then go into your finished position right here, right? So that's basically resistant flexion, and if he was to lie on his back and do the same exact thing, it would resemble a bench press, right? So great exercise for folks that don't really tolerate bench press, but want to start working towards that. Now that we went through a bunch of rotator cuff exercises, the next thing I like to do is try to strengthen some of the helper muscles. One of the main helper muscles in the bench press we tend not to think about much is going to be the serratus anterior. So we have a lot of EMG studies showing it's very active when we perform press. If we think about pressing this way or pressing overhead, the weight is trying to retract me, and I'm trying to fight against that by trying to protract, right? If I'm doing a bench press and I'm aggressively pulling my shoulder blades back, maybe I'm not going to be using my serratus anterior quite as much, but still the weight is actively trying to push you back, and you're fighting against it. So the serratus anterior is going to be very important to train. The other part is that early on in rehab, folks tend not to tolerate bench press very well, but they tend to tolerate protraction very well. So let's go ahead and punch that baby up towards the ceiling. The idea is you keep the elbow locked out as much as possible. We start the exercise to the shoulder retracted, and then from here, you're gonna reach up towards the ceiling like you're trying to punch up to my hand. And from here, bring the shoulder blade back down into retraction and then punch right back up again. Very good. So great beginner exercise, usually very well tolerated, and it's gonna help you eventually get back to pressing. Next exercise I really like for the serratus anterior is going to be a push-up plus. So from here, we'll have Mike set up in a push-up position. Elbows stay locked out. He's gonna sink through his shoulder blades and then push away up towards the ceiling. And when he comes back down again, he keeps his elbows locked out and then pushes away again. Yep, you go ahead and take a breather. Early on in rehab, pressing might not feel good, right? If Mike could tolerate pressing at this point, I'd probably give him the full push-up because we're working a very similar pattern to what we want to get back to. If people aren't tolerating this, the push-up plus is actually really good. And just like the serratus punch, it's usually very well tolerated. Another exercise I really like at the beginning stages of rehab is going to be a shoulder tap. Now, if your athlete can't handle a shoulder tap from the floor, you can raise them up on a bench and even up to a countertop or a wall if they need to. As you raise up, it ends up getting easier and easier. If they can tolerate it, we'll do it all the way on the floor. But first step here is you maintain a push-up position. Great job, Mike. And then from here, I want you to push away from the floor as much as you can, so we're actively in protraction, serratus engaged. And from here, pick up one hand and try to tap your opposite side shoulder. Let's do a few repetitions. Yep, back and forth. And you go ahead and take a breather. So the idea is that any time that Mike picks up one hand, all of his weight is now being borne on the stand side arm. So when we're doing a double arm push-up plus, both arms are used to create the movement, right? But when we go to one arm, now we have all the weight on one. So it just makes it more challenging as a progression in exercise. Another really fun game you can play with your patients is just to take all the cell phones in the room, right? And when you're performing your shoulder tap exercise, open up those phones, go to the Fitness Pain Free YouTube channel, have them hit the like on just any video you can. Make sure you hit the computer over there too. We got another one. Just like, subscribe, get everyone involved. Next set of exercises are scapular strength exercises. One of the reasons I really like these, A, is because you see this all over the medical literature as types of exercise are usually beneficial for rotator cuff related pain. B, they're usually very well tolerated for folks at the beginning stages of rehab. The easiest one to perform is going to be, I call it an A. The reason why I call it an A is because you're making the letter A with your body. This would be a letter T, this would be a letter Y, U, W, this is an A, right? So to perform this movement, we're gonna have Mike have his chest down on an inclined bench, or you can also do this face down on a table. Either works A-okay. If you don't have a bench or a table, you can actually just bend over to perform this exercise. So from here, we're gonna have Mike relax his arm, fully reach towards the floor, and his motion first is gonna be turn the thumb out, right? And then from here, bring the hand up to the hip and try to retract the shoulder blades as you go. Let's do a few repetitions. And what we're looking for is trying to bring the shoulder blades together and hand up towards the hip. We're gonna make sure we don't go too far because that can be a little bit painful, but if someone's feeling great with the extra range of motion, I'm also okay with that. Take a breather for now, Mike. So as folks start to progress, we can go towards a T and a Y. Just keep in mind that although these are great exercises, if someone is really painful, oftentimes not tolerated well in the beginning. So maybe you start with your A's, and as your patient starts to get a little bit better, you incorporate T's and then eventually Y's. So the T is also pretty easy to perform. Hands relaxed to the side, fully reached. And from here, going up into a T position, retracting the shoulder blades, yep, and hand ends up being level with the shoulder. Let's just do one more repetition. Yep, that looks great to me. And the last letter will be a Y, which is going to be exactly what it looks like, hands overhead in the Y position. So go ahead and do the same thing for me. Keep in mind, this is the hardest of the three, so people in shoulder pain usually don't start here. And the other piece is you don't have to get quite as high. If you're working with an Olympic weightlifter who needs to get strength and stability at that end range, I say, yeah, eventually you have to work up there. But for the average Joe, you don't necessarily need to get as high as the T or the A. I want to finish up by talking a little about rowing exercises. So for folks that have rotator cuff related pain, especially people in the gym, usually pressing feels like garbage, rowing feels phenomenal. And that's actually nice for a variety of reasons. So for one, performing a row exercise is a whole heck of a lot like performing an A as well as a T. So we're probably training the same musculature that research has shown to be beneficial for folks. The other piece, you'll see a lot of row variations and rehab programs in our medical literature being beneficial for folks that have shoulder pain. So it makes sense to try and include them. The other piece is that we want people to feel like they're still athletes when they have pain. So if they come in, rotator cuff related pain, and they can't press at all, but they can row a lot, I actually give them a ton of rowing exercises because it makes it feel like they can still train. And the other piece is probably helping them with their shoulder pain. So one of the easiest variations to start with is just going to be a chest supported row. So Mike has 2 dumbbells here. We start chest fully relaxed and supported on the bench. And then from here, I'm going to pull the dumbbells up towards my ribs, yep, and retract shoulder blades. On the way back down to like a full reach, and then repeat for reps. Very good. And this looks great to me. Any pain in the shoulders? Wonderful. Let's take a breather for now. The second exercise I really like is a dumbbell single arm row. Just have you pop up for now, Mike. You're gonna take your bench and you're just gonna make it flat. So here, take it flat all the way. We just need 1 dumbbell. Let's have you post up. Now, the reason why I like this exercise, A, is because we're rowing. And rowing is good for the shoulder. The second reason why I like this is the stand side arm. So Mike's shoulder has to push into the bench while he's doing this. So not only are we getting a nice strong recruitment of, let's say, the lats and the rhomboids and the mid-trap by adding a row, but on the other side arm, we're aggressively pushing away, getting that serratus working some shoulder stability. Let's do a few repetitions here. Yep, big reach and then just pulling to the ribs back and forth. A little bit of rotation, that's A-okay. I think the single arm row is also phenomenal because you're getting a little bit of anti-rotation with that. So a lot of benefit with this exercise. All right, first thing, let's chit chat a little about pain. Is it okay to push through some pain during these exercises? And yes, there's a bunch of research to show that pushing through some pain is okay, right? How much pain is okay? Generally speaking, I want the exercise to feel tolerable. So I say, Mike, let's do some sideline dumbbell external rotation. He does a few. How's that feel? A little painful. Is it tolerable? Yes, it's tolerable. All right, let's keep that exercise. The other thing you can try is using the pain monitoring model, which essentially means that if your pain is below a 5 out of 10 while you're doing the movement, that night and the next day you're kind of back to your baseline, it was probably an okay exercise. If you look at the research where they compare people that have rotator cuff related pain, one group is allowed to push through some pain, the other group is not. You look at the long-term outcomes, they're the same. So if we can push through a little bit of pain and people can do things they like to do in the gym, then that's great. That's a win-win situation because we know they're gonna get better over the course of time. They're not actively hurting themselves by continuing to train, right? So how about sets and reps? We doing 3 sets, 4 sets, 5 sets? How many exercises do you use? My general recommendations are to pick 2 to 3 exercises from each of those categories. So a couple rotator cuff exercises, a few serratus and scapular stability, and a couple rows. plug them into a program, perform 2 to 3 sets of 10 repetitions, and do this 3 days per week. I will say that at the end of the day, there's research showing 1 exercise, couple sets versus 3, tends to have about the same effect. You can use a strengthening exercise or you can use a stretching exercise, and both of those exercises have a similar outcome. And what that means to me is that as a physical therapist, you have a lot of freedom of which exercise to use and how many sets and reps. The other piece I will say is that specificity is important. Let's say Mike wants to get back to powerlifting, and generally speaking, he follows a total body split. He lifts 3 days per week. Now, I know he does 3 upper body exercises on those days, and he does 3 to 4 sets. My rehab program eventually wants to mimic that. So when I'm choosing exercises, I can think about where Mike is currently and where he wants to be, and try to develop a very similar program to get him there. All right, so your patient has some baseline exercise to improve their rotator cuff related pain. But if they're going in the gym, doing heavy overhead press, heavy bench press, and they keep on aggravating the shoulder, they could never make progress or potentially get worse. We also need to know how to modify movements that are provocative, like overhead press in the gym. Well, I got a video for you. I'll leave a link in the corner. Once you go ahead and click on that, I'll teach you my favorite modifications to the overhead press for folks that have shoulder pain in the gym. See you there.